Non-invasive ventilation is a form of ventilation for children via non-invasive mode. So it's to actually prevent endotracheal intubation. We use a mask and we do the ventilation via mask. So the indications are basically indications for acute and chronic respiratory failure. So the main areas for acute and chronic respiratory failure in children are upper and lower airway anomalies and infections, and lower airway infections such as pneumonia, bronchiolitis. And also indications for chronic respiratory failure include upper airway obstruction, such as obstructive sleep apnea. If you're not able to overcome the obstructive sleep apnea with positive airway pressure with using just a CPAP, we can use non-invasive ventilation. Other indications include children with neuromuscular disease, both because they may have upper airway obstruction and also chronic respiratory failure. And the last indication is central causes for respiratory failure. So these can be because of the congenital central hypoventilation syndrome or tumors of central nervous system. In these kids, you need to do the ventilation with a backup rate so that you can support them even if their brains are telling them not to breathe. The ventilation device does ventilation with a rate. So in children with acute respiratory failure, now there are more and more studies for the use of non-invasive ventilation. But sometimes if the breathing rate and the CO2 is not responding to the non-invasive ventilation, you still need to monitor these kids very closely, so that if there's no response, that they may still need intubation if the respiratory failure is not responding to the non-invasive support. So in these cases, the monitorization should be very carefully done. And also in children who have excessive secretions, the non-invasive ventilation may not be possible. If there are not good masks fit for these children, or if the mask is not well tolerated, it cannot be done because we need an interface to use the non-invasive ventilation. And also if the child is not able to protect his or her airway because of the risk of aspiration, it's not feasible to do non-invasive ventilation in those cases. There are a lot of myths around children not tolerating non-invasive ventilation because of the interface. So non-invasive ventilation needs to use an interface, either a nasal mask or oral nasal mask in the long term. So if the child doesn't have a good mask fit, or if the child is not synchronizing with the machine, these may be barriers to the non-invasive ventilation. Also, if there's a complication of the mask, such as pressure sore, or the child is not liking the mask and the pressures, these can be again barriers to non-invasive ventilation, which can actually be easily sometimes overcome. So you can do a sleep study and look at if there's a leak and that's the reason for the intolerance, or if the child is synchronizing with the machine or not. And you can use a couple tricks to titrate the machine so the child can actually synchronize and the machine is helping her or him to breathe easier. So other smaller but not less important factors can be nasal or nasal drying or drying of the eyes. So these again can be prevented with maybe nasal saline drops or nasal steroids and a good mask fit. And some children find it more comfortable if they have different masks, so they can use one mask some nights and the other mask the other nights, which may actually help also to prevent the pressure sores.